Assalamu alaikum. In this video, we want to discuss the second part of the cardiovascular system, which include the systemic artery. In this slide, we see that the blood vessel histology composed of three layers, inner layer and middle layer and external layer. The inner layer, which is composed of simple squamous epithelia, and we call it tunica intima. And this just deep to the endothelial, we found there is a basal membrane and layer of subendothelial connective tissue that offer support to the overlying cell. The second layer, which is composed of smooth layer and is a muscular layer, we call it tunica media, and the ottest layer is composed of collagen fiber as well as elastic fiber. That means composed of connective tissue and is responsible for anchoring the vessel to adjust to the other organs. These arteries were branched to small artery and small artery. Finally, they call it arteriole, which is have less muscular layer, and finally in the tissue, these arterioles were branched to very small vessels. We call it the capillary. This capillaries deliver blood at the level of the tissue. You see here, this is the capillaries. Yes. Now we want to follow the pathway of these vessels from the heart. As I said before, that we study here the main systemic artery. We start the bigger artery in the body, which is the aorta, and rise from the left ventricle. We call it ascending aorta, and when it arched to the back, we call it aortic arch, the same artery, and then the same artery descend to the thoracic cavity and the abdominal cavity, and we call it descending aorta. This is the descending aorta, and this is the ascending aorta, and here is we found the aortic arch. As soon as it arched, it gives us three main artery, one to the left, which pass under the clavicle muscle, and we call it left subclavian, and this middle one go to the head and neck to supply the brain and the muscle of the neck as well as the facial muscle, and the third one which pass to the right side, and you see it is bigger than the others, and it branch into two arteries. One supply the head and neck, and the other supply the right subclavian. This is, we call it the systemic artery. Here we found that the blood which supply the neck and the head is branched from the brachiocephalus. This is the common carotid, and this artery also branched into two branched, one external, we call it external common carotid, and the other is the internal carotid, which supply the brain. And these two arteries similar in the left side, but in the left side the common carotid rises directly from aortic arch, but in the right side it rises from the brachiocephalus. Now, if we want to follow the pathway of the arteries that supply the upper limb, this is the right limb, and here we found that the aorta rises from the left ventricle and it arch, and it just give us the brachiocephalus, and the brachiocephalus pass under the clavicle bone, and we call it subclavian artery. The same artery, when it reaches the axilla, we call it axillary artery. Then it reaches the brachial bone, and we call it brachial artery. And at the elbow, it's split into two artery, one to the ulnar bone and the other to the radial bone, as well as the muscle of this in this area, and we call it the ulnar artery and radial artery. The radial laterally, and the ulnar is medially. Then it join together to give us the deep and superficial palmar artery, and to supply the muscle hormone of the hand. When the aorta descend from the heart, it reach the abdominal cavity, and at the pelvic near the lumbar region, the descending or the abdominal aorta give us two branch, one to the left and the other to the right, to supply the pelvic as well as the lower limb. As soon it split, it give us the external, or sorry, the common iliac artery, which split again into two branch. One, we call it internal iliac, which supply the viscera, the organ which located at the pelvic cavity, and the other is external iliac, which move to the lower limb or to the leg. As soon it reach the femoral, we call it the femoral artery, and then at the knee joint it gives us the popliteal artery, and then at the region of fibula and tibia we found here three branch, the posterior and the fibular posterior tibial and the fibular artery. Then at the ankle joint and to the foot we found some artery that supply our foot, with lateral plantar and middle plantar and the plantar arch and digital artery. This is all for the artery that supply the head and neck, as well as the upper limb and the lower limb. The blood retained back to the heart via the veins, and it retained from the head and neck via the external and internal jugular vein, and these jugular vein give it blood to the brachiocephalus, and then to the superior vena cava. From the hand, or from the upper limb, also the blood retained back to the heart via palmar vein, and then superficial venous palmar, medial, anterobrachial, and also we found here the radial and the ulnar, same as the artery. And at the elbow they give us the brachial vein, and then it take the name of the axilla, and we call it axillary vein, and it go to the subclavian. All these the same artery, but take a different name. And then it reach the heart via the brachiocephal, superior vena cava. Here we have additional nerve in the hand. One we call it cephalic vein, and the other is basilar vein. This is to support the blood retained to the heart. At the lower limb also, here we found many veins retained back with the blood to the heart. We have the plantar venous arch, and we have here additional vein, we call it the saphenous vein. Also the same fibular vein, posterior tibial vein and popliteal vein, and all these veins flow to blood in the femoral vein, and then to the external, and also it connect with the internal, and it become the common and give it the blood to the inferior vena cava and take it way to the or take it way to the heart. This is all for the blood that supply the tissue and which retained back with the blood to the heart. I mean the artery and vein. And thank you.